Distinguished participants, renowned speakers of the webinar, partakers, ladies and gentlemen, it gives me immense warmth and great pleasure to grace all of your presence in the webinar on career opportunities in hospital management, organized by Integra Ventures in collaboration with Pratiksha Hospital, Guwahati. I am Lipika Sharma, Chief Academic Coordinator and Healthcare Management Consultant, Integra Ventures, the moderator of today's webinar. It gives me tremendous contentment to be presenting the welcome speech amongst the most esteemed personalities who have won accolades in their respective fields. Speaker 1 is Mr. Rohit Upadhayay, a healthcare professional who have a vast experience of 14 plus years in hospital industry. His interest areas includes operations and quality. Mr. Upadhayay has graduated from Guwahati University, PG Diploma in Computer Applications from MLCRPV Bhopal, PG Diploma in Hospital Administration from CMC Vellore, MBA HCS from Sikkim Manipal University, and he is also a Six Sigma Green Belt certified. Currently, he is associated with Marwari Hospital, Guwahati as a hospital superintendent. He is also the General Secretary of Association of Healthcare Provider India, Northeast Chapter 1 from January 2021 till date. The HPI chapter has received the Best Chapter Award from the Central Team during his tenure as General Secretary. He has also received COVID Warrior Awards from various organizations in 2020, 21, and 22. Speaker 2 is Dr. Vijay PV, a seasoned healthcare management consultant with 13 plus years of experience in hospital planning, project commissioning, operation scaling, design thinking, lean applications, to list a few. Dr. Vijay holds a postgraduate degree in hospital management from Administrative Staff College of India, Hyderabad. Currently, he is the partner and senior consultant at Integra Ventures and advisory board member of MGM Healthcare, Chennai. These speakers will highlight and brief you on all the vast opportunities that is available in the healthcare management domain. The webinar schedule brushes upon the benefiting theme that discusses the career aspects of hospital management. The topic for discussion for today's webinar was chosen keeping in mind the interest of the youth. Before we begin this webinar, I would like to express my heartfelt gratitude to all of you who sincerely committed to this event to make it a success. This event would have been impossible without the support of each and everyone present. I ensure the webinar will be profitable and fruitful for everyone present. We have also got a surprise for you at the end of this session. So stay tuned to learn more about it. And to make sure we are helping you as best as we can on your career opportunities, we have chat box to source your questions. Feel free to drop questions on the topic. The moderator will collect the questions so that the speakers can answer to them at the end of the presentation. Also, don't worry about making the notes immediately, since we'll send the sessions recording and the presentations your way by tomorrow at your registered email IDs. So without further ado, let us start the webinar. Speaker 1, Mr. Rohit Upadhayay, you may share the screen and start the session. Thank you.
Lipika, can you help me to, can you share the screen from my side?
Yes,
because,
all right, all right.
Sangeeta,
yeah. Okay, all right. Sangeeta, you can share the screen. You may start the session, Mr. Rohit.
Good afternoon to all. Good afternoon to my co-speaker, Dr. Vijay. So today, wonderful session, and I thank Integra Ventures for giving me this opportunity to speak on career opportunity in healthcare management. So the slide is started. You can put the slide,
yes,
please.
Yes. The slide is visible, Mr. Rohit?
No.
No, the folder is visible, Lipika. I think you need to share. Who is handling? Sangeeta?
No, I am handling. One second. Is it visible now?
Yeah.
Yes, yes, it's
Sharing.
visible.
Yeah.
Okay.
So I keep it very simple to understand the present scenario of the healthcare in India and Assam, because we are talking from the Assam. So secondly, top institute in India to study this hospital management or hospital administration course, and various career opportunities in healthcare management qualified individual. So before I begin this presentation, let me just give my own example itself, because when I was pursuing my graduation in under Guwahati University, I wanted to become army officer. So I took my NCC and other things. So during my first year of graduation, there was one career counseling session organized by our college. So in that, it was around in 2000 and 2001. So the college management has organized the career counseling, specifically indicating this hospital management course. Then I was also participant. I was quietly listening to all those eminent people who were speaking at the time. So they said that hospital administration is one area where from northeast very limited people in your fingertips you can count people are there. They don't know there is huge scope and huge growth in the healthcare industry, which all we say it is recession free industry. Then I somehow I could not able to manage in this army because of the connectivity and other things. And then I took this hospital administration course through CMC Vellore, and after doing a lot of research where to study, how to study, and when to how much cost will incur, because a lot of factors are involved while you choose this course. So just can you move to the second slide? Yeah, see, this is the scenario of India, bed availability in India and Assam. As per WHO says, per 1,000 population, we need 2.9 beds. But whereas in Assam, if you see, there is less than 1 bed per 1,000 population. In India, if you compare with the India, it is 1.4 bed per 1,000 population. It is far below than the as per the average given by the WHO. And as with compared to the India, the Assam is much below, and there is huge scope. The shortfall of the bed, if you see the shortfall of the number of beds, it is more than 20 lakhs beds in India, and in Assam itself, it is more than 65,000 beds are shortfall as comparative to the population, because we know almost Assam has 3.3 crore population, and actual bed strength both government and private is around 25,000 only. So there is huge scope of opportunity for new hospitals to set up and new facility to come in the market. Can we move to second slide? See, as per NITI Aayog, what it says, there is healthcare industry is growing from 2016 to 2022. It is growing at a rate of 22% CAGR, compound annual growth rate. The 22% growth in any industry is very phenomenal growth. 22% normally other industry, if you see, it will be around 10 to 12% growth. But healthcare in the initially it was estimated it will grow by 15 to 16%. But due to the COVID and other thing, many hospitals has come up, and government also set up few of the hospital in Assam. If you see, lot of most of the district, almost 18 district is coming up with the cancer care hospitals, and in Assam itself, in last 5 years, so many medical colleges has come up. So there is huge growth potential in the healthcare industry, and it is estimated if trend goes same way, it is estimated that the healthcare growth will be almost 19% till 2027. And the employment generation, I need not have to talk, because since growth is there and employment generation obviously there will be there. At present, healthcare industry directly employing 4.7 million people directly. See, directly, why I am telling directly and indirectly, there is for each hospital base, any tertiary care hospital, each hospital bed we need around 5 people per bed. We need to employ around 5 people directly, and another 5 people will be employed through indirect, like as those will be vendors, those will be other contractors, suppliers, all those things will be another 5 people will be for one each bed. There will be 10 employment generation in any healthcare sector. And the sector has the potential to generate 2.2022. It is not my report, it is Niti Aayog which is created. For this rate, it is expected to reach $372 billion by 2022. Next, please. In 2020, the India's medical tourism market was estimated to be worth of $5 to $6 billion, is expected to grow to 13 billion by 2022. And India itself, through the diagnostic industry itself, India currently value around $4 of around 4 billion, where radiology is 10% and laboratory is contributing around 15%. Why I have brought this medical tourism here? Because see, in India, the cost of treatment is comparative to the Western European countries are much more lesser. So the people prefer to travel India, get themselves, for most of the elective cases, get themselves operated, and have the tourism also for they have the sightseeing and other things also, and then they can easily go back to their own place. Next, please. See, this chart shows the growth in healthcare industry from 2008 to 2022. See, this 2020-22 I had given, it is fast growing. So, so from 45 billion US dollar, and last almost 12 years it is 372 billion dollars. So the huge potential of growth in the healthcare industry. Next, please. See, healthcare. If you say about the healthcare does not confine to the hospital itself. Healthcare has a lot of other aspects also. I had mentioned home healthcare here. Why home healthcare? I had specifically mentioned because nowadays most of the, you might be knowing this, home nursing. Lot of NGOs, lot of organization is coming up with home nursing concept. Why? Because some patient who can be managed ambulatorily at their home, they need not have to visit hospital for small procedure or small uh, uh, nursing related procedure or doctor related procedure also. Many organization has come forward, many NGOs has come forward to support this home healthcare system. Now this home healthcare system can be broadly categorized in the three category. One, home nursing, home medical consultation. Suppose for example patient who need catheterization, he or she need not have to visit to the hospital. So the NGO people or they have the trained people, or hospital people also can go and just do the procedure and come back. Home healthcare device, patient who need monitoring, like as they need monitoring for 24 hours BP, they need monitoring for pulse oximeter. All those devices are readily available in the market. They can purchase, they get in rented basis also. So those patients can be managed at the home itself. And patient next, after this COVID, many patients don't prefer to reach to the hospital or travel to the hospital because of the hesitation of fear that they may get infected. from the COVID. So through teleconsultation, now a lot of this company has come up, startup has come up, where they make their own app-based application, and that through this application they connect to the hospital, and from the hospital the patient gets consultation, and they charge very minimum amount also. So that kind of facility already is there in the market, and it is in coming days it will grow up. It will grow, expected to grow almost 20% per CAGR per year. It is expected to grow in coming days. And see, other aspect of the healthcare, see, it is not confined to the hospital itself, which I said, home care, nursing, and another is healthcare in involved in the research activities also, public health also, and nursing home, government organization, rehabilitation center, single doctor owned clinics, and healthcare association, healthcare consulting firm, like as an Integra is also one of the healthcare consulting firm, and health insurance, health, mental health organization. These are the different sector where the hospital management or healthcare management graduate can be employed or can be engaged, because they know the tips and part of the healthcare, plus and minus of the healthcare. So person having the domain knowledge, person having the knowledge of the healthcare can be employed in any of the sector. So can you have the next slide? See, telemedicine, which I said, it is growing, and it is expected to grow almost 31% CAGR from 2020 to 25. See, you can see the bar chart from 2010, the telemedicine concept was started almost, and from there to 2025, this is the projection. So almost 5,410 USD million dollar it is expected to grow in India itself. So there is huge potential in this sector also. Can you have the next slide? See, these are the news article which is published in Business, where the study estimated that the market has a potential to grow an additional 5 billion with the right impetus. So next. This Economics Times already, the boom in healthcare industry farm is not showing sign of slowing. So why I had given these two specific slides, Business Standards and Economics Times, because they from this all this analysis and other things, they have put it in their article. There is huge potential in grow in this healthcare industry to grow in coming days. Next. So now, what are the degrees and diplomas in hospital management graduate can pursue? See, MBA in hospital management or administration, PG diploma in hospital management or administration, PG diploma in hospital and healthcare management, MSc in hospital administration, master in hospital management and administration, fellowship in hospital management and administration. Another one is master in public health and management. So these are the master course. I had not given post graduate course. I had not given the graduate course also. There are some courses in graduate level also. There are different like bachelor, or they say BBA in hospital management, BSc in hospital management. Those I had not given. But these are the master degree or postgraduate degree or diploma courses. Normally, university they offer with this nomenclature. And there are other courses where you'll get short term as well as 3 to 12 month short term courses. Those courses may be named as a diploma, fellowship in hospital administration management, executive management program in hospital management. Institute like an IM has come. Most of the IM they have started offering these courses, though the fees structure is quite high as comparative to other institute. Which I had mentioned earlier, this hospital administration, PG diploma, MSc, fellowship. See, all these courses, if you ask me, obviously there will be one question, how much money or how much this total expenditure we have to bear for pursuing all these courses? Obviously. So these courses normally university they offer from 2 to 4 lakhs minimum. I'm average market rates. Some may go up to 5 lakhs also, 6 lakhs also. But average, if you see the market rate and if you see the university charges which from the individual, it is 2 to 4 lakhs rupees they normally charge from the student. Next, please. See, these are the top institute where these courses are offered. The Institute of Health Management Research, Jaipur, All India Institute of Medical Sciences, Delhi. But this is exclusively for MBBS who have completed MBBS degree in AIMS, they can enroll. Tata Institute of Social Science, this everyone knows. Faculty of Management Studies, Delhi. Apollo Institute of Hospital Administration, Hyderabad, Jubilee Hills. Christian Medical College, Vellore. ASI Hinduja Institute of Health Management, Hyderabad. Next. KEM Healthcare Management Institute, Pune. IMS Devi Ahilya Vishwavidyalaya University, Indore. Institute of Pharmaceutical and Healthcare Management and Research, Kolkata. School of Management Studies, University of Hyderabad. Goa Institute of Management, Manipal University. Symbiosis Institute of Health Sciences, Institute of Health Management Research, Bangalore. School of Health Science, University of Petroleum and Energy Studies, Dehradun. National Institute of Health and Family Welfare, Delhi. Madurai Kamraj University. These are the top university which they offer this hospital or healthcare management course. Next. See, if you ask me why healthcare management, we know that hospital healthcare is a recession-free industry. Everyone knows this is a recession-free industry. Is because people tend to fall sick. People obviously will fall sick because with the age, with this lifestyle diseases and other things. So there is always, for whether people have money or people does not have money, healthcare need is always there. It does not come to the rich, it does not come to the poor, it comes to the all the peoples. So this healthcare is career, how it can be stable career, it can lead to stable career. See, there is always demand in healthcare. See, as long as there are humans, there will be need for healthcare. This demand reflects the increase in number of students in healthcare related degree program. So human body is complex, you know. So the people from small toothache to the kidney transplant to the liver transplant, bypass surgery, you need to visit hospital, you need to visit clinic, you need to visit CEO doctor. So there will be always demand in this sector, and the people who pursue this course, obviously that need will be there, demand and gap, supply need is always there. Secondly, the innovation. Every day there is change in the healthcare. Earlier there was no MRI, there was no CT machine, no robotic surgeries were not there. So medical technology is drastically changing. So the people expectations are also changing. So they want earlier the also, if you see 20 years back, gallbladder operation or your appendix operation was done open. And most of the institute, only some premier institute where that they used to do the laparoscopic operation. Now, in most of the institute, from open surgery, they have converted to the laparoscopic institute, laparoscopic surgery. So similarly, earlier the labor delivery was painful delivery, people used to say. Now there is take painless labor delivery. Similarly, uh, robotic surgery has concept has come up. The people say that through robot they perform bypass surgeries, they perform the knee replacement, other things. So there is innovation in the healthcare. Obviously, there is uh, new things are coming in the healthcare. Secondly, expectation and change. So people's are growing, people's expectations are changing. Their people's their lifestyle is changing. So there is always the expectation. There is always demand in the expectation. There is always what say they have more expectations from the hospital and the health institute. So obviously, to fulfill those expectations, people, hospital administrator have to play a very major role. Coordinating, liaising, meeting, all those things have to be done by the hospital administration people. And secondly, life saving. Obviously, if somebody falls sick, so health hospital, even though the dead body is brought to the casualty, brought dead patients are many of times they brought dead patients are brought to the casualty. Why? Expectation is there. Once the patient may reach to the hospital, he may survive also. There may be some magical changes also. The people who are walking in the hospital, they can do something to recover or revive his life. Being healthcare professional, it is not easy. See, mental, emotional and physical pressure is always there, whether you are on present in the office or not, whether you are on duty or you are not on leave. So you are bound to get calls. You have to deal with the people's emotions. Many of the times it happens, people who die in the hospital, after that you have to complete the formalities, you have to console the patient party, and you have to get the bills also recover from the patient party. So many of the times, as per expectation, the results are not uh, as per the patient or family's expectations. Results are not outcomes are not. The patient may not recover fully. Patient in between they may die also. But people who are working in healthcare, they must be dedicated to serve the people with 100% with their open heart. If it is there in their heart, then only those people who have dedication, who have emotional and physical ability, they should join the hospital administration, or they should join in the healthcare. Many of the time during our interview process, for people who are not from the healthcare background, people who are not connected to the hospital, most of the time I often ask the question, आपको खून देखने से डर लगता है क्या? Because some of the people, they, after seeing the blood, they faint. So those people will not able to serve in the healthcare industry. So before choosing your career, before selecting your career, you must identify whether you have that compassionate heart to serve other or not, whether you are dedicated in your in the profession of serving humanity. See, at the end of this, you need to have a peaceful sleep also. So so you have to judge, you have to analyze yourself, or you can ask your near or dear one to analyze your thought, and then you decide whether you can join the healthcare industry or not. Next slide, please. See, this is the typical role of the hospital administrator, what they need to do. See, they need to manage with the vendors, they need to manage with the statutory, they need to manage with the safety of in-house people as well as external people, review, audit, and budgeting, connecting the people, quality process system you have to develop. Many of the times, because of the poor system processes, so many things, haphazard things happens, due to the not checking properly. Few days back, you heard the news of some fire incident in some of the hospital. The fire safety measures may not be have been taken. So those all these things, and connect to the medical professionals. See, this medical practitioner doctors, those who are super specialties, those who are specialized in some particular surgery, medicine. See, they because of their healthcare industry is running. So you have to satisfy their egos also. So you have to connect to the other people's also, lies in coordination, and ultimately all this need to meet, and patient should go with a smiling face. The next, please. See, this are the different roles that healthcare professionals will have. So if you ask me, so in the top, I have categorized in three categories. One is the top level, another is middle level, and another is ground level. In top level, CEO, CFO, CEOs, Chief of Nursing Staff, MD, Director of Facility, Medical Superintendent, all those in the top level. Now you might have questioned the top level, how much the salary they earn. So in the top level, if you ask me, the average salary, I'm not talking about range. Average salary is around 2 lakh rupees. Minimum, I'm talking about. It may from 1.5 to it will go up to the 5 lakhs rupees also. So middle level management, the operation manager, IT manager, HR manager. So all these are middle level manager, facility manager, and then nowadays, so now concept is coming, new concept, that is digital marketing manager. Earlier, there is no word of digital marketing. Now the concept digital has come up. So digital marketing manager, digital marketing specialist. So those are considered to be the middle level manager. They are the basically license between the top management and the ground management, ground level. So in middle level management, average salary is around, you can expect around 70 to 1 lakh rupees. In northeast market, I am talking about. And ground level level, it is from starting from the management who has graduated or post graduated in hospital management. Ground level, from management trainee to it will go up to the assistant manager. In between there are junior executive, senior executive, so assistant manager. Up to this level can be in the ground level. So ground, how much salary you may think it from in ground level, it will go from 15,000 to it will go up to the 50,000 rupees. It will go. Next, please. So just like a hospital is incomplete without doctors and nurse, a hospital administrator ensures that the hospital has the entire infrastructure intact in order to assist the doctor and patient alike. So see, the hospital administrator, uh, there may be one post, but people who are in working in hospital, they have different roles in hospital, which I say from front office executive to the chief executive officer of the organization. There are different roles. It is not one role that hospital administrator designation is only the one role who works for the hospital. There are different people who work for the hospital. So all peoples from the ground level to the top management level. So every peoples who work in the hospital, they must do some of the hospital administration or management or diploma courses so that they know uh, uh, they may be knowing the practical part, they know theory part also, and this is required because many of the things routinely we are doing work, but once we come to the onboard of the some particular structure course which we have not thought, it will be highlighted on the particular course or on that particular learning study and things. So uh, so different roles you can play from front office executive to uh, to CEO level also. And in this, there are different people which I said already: manager level, assistant manager, executive, senior managers are there, DGMO is there, deputy general manager, general managers, operation heads. So all these things combined together, ultimately, as I in the beginning I said, for one bed we need five people's different category. Housekeeping managers are also there involved. So facilities, engineers are also there. So that's the thing. So I come to the end of this my presentation. So if any questions, we can take it later on.
Yeah, we will have the chat box. So in the chat box, the participants can drop down their queries. And at the end of the session, we will take each and every questions. Yeah, Sangeeta, you may announce.
Yeah, I request everyone to kindly switch on their camera so that we can take a screenshot and then we can share the pictures on our social media group, and like we'll try to tag each one of you by on that picture itself. I repeat, I request each one of you to kindly switch on your camera so that we can take a picture of our screen, and then we can share it on our social media group, and we'll also try to tag everyone.
Sangeeta, done?
Yeah. There are a few more participants who haven't switched on their camera. Kindly switch on your camera, please.
Yeah, Lipika, I think that can go on. Can we just start the next session? Yeah.
Yes. Dr. Vijay, you'll share your screen, or
No, I
should
would
do it
request.
from your end?
Yeah. Can you just put it up?
Yes. Is it visible?
No. We have not shared the presentation.
Okay.
Yeah. Can you make it full screen?
Yes, done.
No, full screen is not shared. Okay, while she puts up, good afternoon, everybody. I'm Dr. Vijay. I'm basically a healthcare management consultant. I have a varied experience of working in hospital consultancy and stuff. So I would quickly try to take you with the same things which my previous speaker left with. That's the career opportunities post-hospital management. There's some disturbance. Can you mute everybody, Deepika?
Yeah. Request.
Yes, sir, it's done.
Okay. So coming to what is hospital management basically. So to further simplify it, I would like to say this is a complete administrative cadre which would run the hospital on a day-to-day basis. So like you have your clinical service, nursing service, the third most important thing in any hospital is an administrative service. So who does this administrative service? It's done by a hospital management graduate. Initially, it was done by anybody, maybe just a BSc or a BCom or an arts graduate kind of stuff. But today, hospital administration by itself has specialized or evolved into a graduation and what we say, master's course, which assists the hospital doctors or hospitals in running the hospital effectively. So coming to what are the options which you have, Lipika, can you just go to the next slide? Yeah. So we'll just touch upon available options for study, career opportunities, and salary packages, which even my previous speaker has touched upon. So I would like to further elaborate on the same. Next slide. Yeah. So what are the available study options? So most of you may be already graduates trying to pursue, or few of you would already be working in a hospital. So for working people who have already been working in hospital or other sectors, for some said family reason, if you're not able to take a break or anything, there are a lot of very good correspondence courses which are available. This is again 1 year, 2 year kind of correspondence course, which you can do, which will add value for already your existing profile. But the disadvantage of a correspondence course, like any other correspondence course, the value given to correspondence course versus value given to a full-time course, there is always a difference. So if things permit, I would encourage people to go into a full-time course than a correspondence course. So like our previous speaker said, what are the options given? See, more or less all the subjects covered in these managements are same, but due to university compulsion or the educational institution framework, they are meant to give you different degrees. It may be MBA, it may be a PGDHM, that is post-graduation diploma in hospital management. It may be MHA, Masters of Health Administration. So in few places, they are also giving you MSc degrees also in the hospital administration branch. But you also have an option to do MD or MPhil, which is a doctorate degree. MD is available only for a MBBS doctor who can do a 3 years MD hospital administration. Again, MPhil is your PhD kind of stuff. This can be done by any of the graduate, bachelor's or master's person. So then there are a lot of certified courses which are available. Again, it is short-term, long-term kind of stuff. So these certified courses are again to fine-tune your skills further. It may be for a working professional. Also, sometimes professionals take a break of 1 year where they get to do a executive MBA. These executive MBAs are well sought of, and people with 4 or 5 years experience in hospital management already and doing executive MBAs are well absorbed by big organizations. So these executive MBAs are given by premium institute like IIM, then this thing, IHMR is giving, even ASCII is giving, TIS is also giving. So this is for the further enhancement of your skills and things. So coming to what subjects you get to learn in post-graduation in hospital management is basically it starts from your basic accounting, your general management, your organizational behavior, your human resource. Then you will get to study cost accounting. You will get to study statistics. You will get to study hospital planning. You will get to study quality and accreditation. You will get to study on supply chain management, which is one of the huge subjects. You get to study the finance. Then you get to study marketing and a few more subjects. So basically all the subjects which come in this management subjects enhance your skill to be an effective administrator. So again, in all these courses, you can also super specialize. Basically, when you're doing MBA and kind of stuff, you can be a healthcare human resource expert, or you can choose marketing, or you can choose operations, or you can choose supply chain management. So these are the kind of subspecialization you get to do. And also today there is a subject called health ethics or health laws. So that is also a very lucrative career path, which most hospital administrators or even LLB people who look into. So this basically builds you the required analytical skills and the required what we say thinking process or thought process to run a hospital administration. Now the other best thing which people can expect, it may not be very fast, but next 3 years or 5 years, most of the state governments are introducing hospital administrative cadre. Like you have IAS, IPS and stuff. Indian Hospital Services, IHS, is going to come soon, because most of the government hospitals, if you see or if you have noticed, all are the clinicians who are taking care of the administrative role. And with lack of already existing clinical manpower, government doesn't want to dilute their post away from the clinical administration. So it would be already few of the states have introduced healthcare administrative skills, but it has not yet been pan India. But very soon that thing would come into existence. Yeah. Next slide. Okay, so coming to career opportunities, I would slightly go into detail in this thing. First thing is hospitals. So obviously after healthcare hospital administration, you have hospital which you can work. So hospital, usually for a freshers, it starts from assistant manager or a deputy manager kind of post, who starts from handling your IPD services, your OPD services, your OT services, or your HR, marketing, purchase, all these kind of activities. So again, based on your strengths or based on your super specialization, which you have done in your MBA or MHA kind of stuff, you can select the stream which you can get into. So basically there are 5 or 6 main streams in the hospital. One would be pure operations. Operations takes care of all the administrative purpose. Second thing is HR, basically handles with the human resource, doctors and all those stuff. Sorry. Then you have marketing. Lot of hospital administration graduates are sought in marketing position because they understand healthcare, they understand marketing, and they can bridge the gap. Then purchase, basically this is also a huge department which is available. Next, there is some amount of finance, and we call it as management information system, MIS. So these two departments are also available. Basically these deals with accounts and all those stuff which will help. And not only accounts, it also gives that management information system required for a head of the institute to run. Basically this takes care of all your data analysis, statistics and stuff. And the important branch I forgot was healthcare IT. See, today most of the hospitals are converting, or they have already converted. Most of the things are done through IT, your hospital information system. So these are the major 5 to 6 opportunities which you have in the hospital stream. Then coming to insurance, again, what I would suggest everybody is, since hospital is key learning area, once you finish your graduation or post-graduation, I would recommend everybody to work minimum for 2 years in a hospital. This will help you to strengthen your understanding and the requirement of healthcare. So once you know basics very strong, you would be able to suit into any of the other career opportunities. The second thing what majorly is available is health insurance. Today, more and more people are getting insured. So health insurance is a subject where a lot of these companies require healthcare experienced people who can scrutinize the bills, scrutinize the clinical part of it. So basically, if you are from a healthcare background, you need not be a doctor. Even if you have done your nursing, if you have done your physiotherapy, if you have done your Ayurveda, homeopathy, or DMLT, lab technician courses, anything, who can understand bit of clinical process and also have the hospital administration background, they are sought after in the insurance companies who will handle the claims and process the claims and stuff. So that sector is also opening up very huge. Then the third sector, like I discussed, it's the public health. In public health, a lot of openings keep coming in National Health Mission or National Rural Health Mission. These are the programs run by the central government. So they take hospital administrators. Either they manage existing public hospitals, starting from a primary health center to a sub-center, to a community health center, to a district hospital, or also they are sought after for implementation of lot of government projects. It may be mother and child health, it may be malaria health, it may be tuberculosis, lot of programs which they do. So they also recruit hospital management graduates to help get those implementation done. Then government hospitals we discuss. As I said, there would be a new cadre of healthcare administrators which would be coming, which is coming into a huge thing. Because if you have followed up the way the central government is reforming the healthcare services, these are healthcare government opportunities are huge. Then coming to healthcare IT, lot of healthcare IT firms are picking up healthcare graduates basically to manage a lot of IT related stuff. It may be Indian or it may be abroad also. A lot of these IT firms pick hospital graduates who can understand hospital to help support the healthcare IT infrastructure in these things. So if you have heard of Epic software or HIPAA compliant softwares and stuff in healthcare, which most of the Indian companies run for US, Canada, UK hospitals and stuff. So that's also a very, very promising career, which most of the people are opting now. So this, if you have done engineering or if you have done a diploma or a IT kind of background, if you specialize in your healthcare management, this sector is helpful for you. Then the other thing is healthcare digital firms. If you have heard of companies like M5, Practo, then what we say, all this digital pharmacy companies, Apollo Digital Health, all these things. These guys are also hiring healthcare administrators who help them into implementation of their programs and stuff. The other thing is consultancy. Consultancy is the one which example we are doing. So basically, once you have a decent experience in hospital and stuff, you can get into consultancies. It may even the big fours, what we call PwC, E&Y, or KPMG. These people also hire a lot of healthcare graduates. So they help in market studies, feasibility studies, assessment, quality, accreditation, implementation, systems and training. So anything to do with consultancy with healthcare management, again, healthcare graduates are sought out of. Then the next one is entrepreneurship. Again, once you have done the hospital management course, if you have worked somewhere, always you can become a healthcare entrepreneur. Basically, you can take franchises. Now, if you see, there are a lot of labs which give out franchises, eye care chains which give a lot of franchises. Even there are a lot of small and medium OPD setups or primary care centers which are given on a franchisee basis. So a good healthcare administrator with a decent exposure can get into these kind of ventures where they can do things on their own. Otherwise, also lot of people, after doing healthcare administration, depending on their place of stay or things, they have opened their own polyclinics or labs or small hospitals or nursing homes, and they have started their own business with this experience. So this is a very vast opportunity once you do your hospital administration, depending on your taste, the place you want and stuff. Again, coming to opportunities outside India, there's huge opportunities, especially Central Asia, Middle East, and all those stuff. They hire a lot of Indian hospital administrators, and also you can get into administrative cadres in Australia, US, Canada, provided you get recertified with their hospital administration thing. So there are also huge opportunities abroad, not only India. Apart from this, there are other things like your clinical research, then there is medical transcription. There are a few other things which a few of the hospital administrators get in. So that's the range which you can look at. And next slide. Yeah, coming to salary package, like my other colleague told, you can expect a package of minimum of 3 lakh rupees once you start in a decent city post your hospital graduation. That is around 20 to 25,000, and it keeps growing as you grow. So this growth is very fast in this sector. As fast you learn, as much as you grasp, and as much as you are supportive in this, you get to grow. So you can become a CEO, you can become a COO, or you can become the district head kind of stuff. It is a public health sector, and they have a package of 2 crores to 2.5 crores. The present administrative cadre which are working in highest posts, it may be group CEOs of different private hospital chains, or you may be head of consulting for big four kind of stuff. They have very good packages. So it's a vast subject. As much as you drive or as much as you can take, you have opportunities in this. And like Mr. Rohit said, this is a 24/7 kind of service. You might be initially, when you are in the initial management or entry level management, you would be required to serve 3 shifts or even holiday postings, because none of the hospitals are shut down on a Sunday or a holiday. It works 24/7, 365 days. So as you mature to mid-level cadre or high-level cadre, you slowly wean away from the kind of stuff. So that's the opportunity which you can look at. Next. Yeah, that's it from my side. I would be happy to take any questions if you have.
So thank you both the speakers for enlightening all the participants in the right career decisions and also the opportunities in hospital management. We appreciate having the opportunities clarified. And I also personally appreciate for your approach to anticipate the participants' intent and also for taking out your time from your busy schedule. Now request all the participants, either you can unmute and ask your queries directly, or you can also drop down your queries in the chat box. We have already received a few queries, so I'll just read out. Chinmoy Jyoti Deka has asked one question. Which are the types of management under clinical and how to differentiate between non-clinical and clinical, like production and operations management, inventory management? Yeah, any one of the speaker can answer this. Which are the types of management under clinical and how to differentiate between non-clinical and clinical, like production and operations management, inventory management?
So basically, clinical services again depends on handling the nursing administrative service and also doctors. Basically, your superintendent or DMS, deputy medical service, director of medical services, and all those stuff. Basically, who manage the clinical team. So if you are again from a clinical background and you have done your hospital management or hospital graduation, these posts are filled with those kind of talents who can manage these kind of clinical requirement. For non-clinical management, mostly you need not be a doctor, but once you have graduated or post-graduated with those streams, it would be helpful.
There's also another question from Mr. Chinmay. Quality management falls under clinical or non-clinical? Marketing, finance, all are under non-clinical management. He's asking whether marketing
again,
and finance
clinical,
also.
yeah. So quality management, again, there are two types. If you see NABH or JCI or anything, there are certain 4 to 5 chapters which is dedicatedly for clinical management. So those things may be difficult for a non-clinical guy to handle, but the other 5 things like your infrastructure, your IT, your other things can be completely managed by non-clinical people. But as you learn in the system, you can manage both. It is not that it is restricted, but if you can learn things, if you can learn infection control, if you can learn pharmacology, it would be easy. You can manage both the things.
I just want to add on this. The quality management is not one thing, or quality, we designate one department as a quality because to coordinate different department, like a clinical department, they need to coordinate, they need to coordinate with non-clinical department, they need to, the standard set by the NABH or JCI, they need to interpret those standards and then get those things implemented across the organization. If it is clinical standards, it have to be implemented through the clinical department, like as medical director is there, through medical director, nursing superintendent will be there. Other diagnostic area like as laboratory, radiology, blood bank will be, and OT will be under this clinical areas. Other non-clinical areas, you know, this housekeeping, purchase, HR, finance, operation, engineering, all this civil engineering, electrical, then your plumbing. So all those things will fall under non-clinical area. But quality management, as you said, it is quality. So quality, it is from the person who says from the person in the main gate to the till the CEO. This quality applies. So the system, process, all those things, and the indicators, parameters. So this quality management, as you say, it is both clinical as well as non-clinical. It cannot be said it is clinical only department or non-clinical.
Udipta P. Kashyap has thanked for highlighting on the concept about IHS. Dr. Saddam has raised a question. What is the qualification required to be a hospital superintendent, deputy superintendent? Is there any rule that only MBBS can be appointed as superintendent or deputy superintendent?
See, there are two aspects. One is the hospital superintendent, another is medical superintendent. So if you have to be medical superintendent, you have to be medical graduate. And then you pursue your hospital administrator. MBBS, if you are asking for any allopathic hospital, then you have to be a MBBS graduate minimum. If you are asking for Ayurvedic ABS, Ayurvedic, you can be Ayurvedic graduate also for Ayurvedic or Unani hospital also. So different for allopathic hospital, basically you have to be MBBS minimum, and then pursue hospital administration course. And for hospital superintendent, you can be non-clinical also, non MBBS also.
The participants can unmute and directly ask your queries. Or you can drop down your queries in the chat box. Yes, participants, any queries? You can raise your queries. All right. So I think both the speakers have cleared your, has highlighted about the hospital opportunities that is there in the region as well as nationally. Yes, there are few queries I would like to raise. Yeah, Nasreen Ahmed has raised one query. What will be the post for the candidates who have done hospital management and is also a physiotherapist?
See, it depends upon your own interest. What will be the post? What is your interest? Firstly, so I'll ask that. It is not like that. The post is designed like as physiotherapy, and then hospital management pursuit graduate will be this much. This post will be there for him. It is not like that. See, you have to identify your interest, whether you are interested in the clinical management, whether you are interested in quality management, whether you are interested in general administration, whether you are interested in operation management, whether you are interested in purchase. So you have to initially identify your area of interest. See, once your area is identified, then you can work on that area, and obviously you can reach your thing.
Yeah, another question is, what is the difference between medical superintendent and hospital superintendent?
The medical superintendent manages the clinical affairs, and the hospital superintendent manages the non-clinical affairs. So clinical area is already we have said, basically doctors, nursing staff, and non-clinical area, rest of the area like is your operation, the quality, your purchase, finance, engineering, sales. So general administrator, statutory liabilities, all those things called under non-clinical area.
Any more questions? Okay, so before we have started the webinar, I was mentioning about a surprise. So the surprise is actually Integra Ventures. We are also coming up with a healthcare management executive certificate program, which will start on August 22nd. So it is a 3 months course, and it will be in both online as well as offline as per the participants' convenience. So there will be 10 modules. There will be 8 case studies, assignments, and also a live project. So those who are interested, you may contact in this number, and we are happy to share that we will give you 10% discount if you register. So the 3 months course will be of about rupees 11,999, and there are also 2 installments. So 50% you can pay during the joining, and also the rest 50% you can pay during the mid of the program. I think there is one more query. Yeah. So that's we are almost the end of the webinar. Thank you, the speakers and also the participants. We will get back to you with the details of this program, and also we will share you all the presentations and the recordings. Thank you.
Thank you. Thank you all.
Thank you. Thank you all. Thank you very much.
Thank you.
Thank you.
Thank you.